don't think it's good.
Go ahead.
But there's an additional concept here, because right now we don't consider the possibility that you might have cantinimab, methotrexate, and a whole host of other medications that aren't so benign. And so we might need additional information before we want to have the cost and side effect profiles of some of these additional medications. And if those then fail, then we can think about the more aggressive surgical interventions. And I remember at the same meeting, somebody was talking about thinking more along the lines of oncology. That's exactly what they do. They look at patients, they see the response to medications, look progressive, then they come in with the big guns, for more aggressive therapies and maybe surgery. And hopefully we could be able to do that down the line. The other thought that I had earlier on when Dr. Fuster was talking was about the education component. And I think the most impactful therapies, especially in primary prevention, would be diet, stress, and lifestyle changes that are incredibly challenging to teach. So I usually don't think in terms of the challenge of educating the patients along those lines. But his point was actually very well taken. That is an incredible challenge. And maybe technology could help us. Maybe you gamify some kind of approach to the patients over the long term and have some kind of engagement. But that should be part of what SHAPE looks at.
But that challenge, just look at obesity, weight problem.
Yeah.
I mean, we have all kind of education in the past 20 years, and we doubled our weight, almost, like that, diabetes, metabolic syndrome. So it's just not really just the education.
No, I'm not sure about that. Well, I think we are somewhat potentially complicit because we taught patients that they should shift their diets. And they ended up shifting their diets. And they ended up having more of a sugar-rich diet, and that contributed to that same problem that we're talking about. So maybe we just need to think in terms of a different strategy. Maybe we should spend more of our time thinking about diet and some other aspects and education.